My name is Dave Hollenbach, the host of From Embers to Excellence, a podcast that explores the many facets of leadership from the perspectives of some amazing people. We discuss the triumphs and failures that have shaped our lives and our leadership philosophies. I've found that it isn't whether we fail that defines us, but when we do fail, how we respond. Leaders dust off the ashes and use their failures as fuel to work harder and as lessons to come back wiser and stronger, more resilient, more determined, and more committed to excellence. Today I'm speaking with Kelle Logan. She is the director of the Tallahassee and Panama City Florida Mind Health Center clinics. Mrs. Logan has practiced nursing for 19 years and worked as a heart transplant coordinator at the renowned Tampa General Hospital. She received her master's degree in anesthesia from the University of South Florida and has been a board-certified nurse anesthetist for 9 years. As a nurse anesthetist, Mrs. Logan worked for Moffitt Cancer Center in Tampa, Florida, providing anesthesia to oncology patients. In 2014, Mrs. Logan relocated to Tallahassee, Florida, where she has provided a wide range of anesthetic services for Tallahassee Memorial Hospital, Capital Regional Medical Center, and Archbold Memorial Hospital in Thomasville, Georgia. Most recently, Mrs. Logan is the chief CRNA at a local pain clinic and has concentrated her anesthetic care to chronic pain patients. She is enthusiastic to combine her knowledge of chronic pain with psychiatric care at Florida Mind Health Center. The practice of anesthesia has prepared Mrs. Logan to provide a powerful and effective treatment for patients suffering from PTSD, anxiety, depression, and chronic pain with ketamine. Her extensive knowledge of ketamine, intravenous therapy, pharmacology, airway, and resuscitative management is paramount. Mrs. Logan's passion has always been to help her patients, and her empathetic nature provides a calming and safe environment for them. And I can speak from experience. I have been getting treatment for my PTSD, and that is why this opportunity arose to interview you, Kelle. I'm extremely grateful to you and Zohar for providing such an amazing service. And I will have the website to the Florida Mind Health Center in the show notes, but it's also on the resources page of my website. So for all those listening, make sure you check out the website, and let's get going. Kelle, thank you so much for agreeing to have this conversation with me, and thank you so much for what you do.
Thank you, Dave, for inviting me. You know me, I will talk to anyone who will listen. So if we, can reach people and help more people, then I'm all for it.
Awesome. Well, let's dig in to really what started it all, and we'll go all the way back to, where were you born and raised, and what were some of your early life experiences that kind of shaped who you are?
I became a nurse because I was born with congenital third nerve palsy. I've had 26 surgeries as a child. My last one was I was 20 as an adult, both on my left eye and my right eye as well. Every year that I had surgery, I had a nurse anesthetist with me who took care of me every single time. She retired shortly after I turned 16, and I had one more surgery to go, and she came in and actually sat with me in the recovery room and stayed with me because she had been with me since I was a baby. And I will never forget, how well she treated me and what such good care she took of me. And it inspired me to want to do anesthesia as well. From an early age, probably I can remember at least being 4 or 5 saying I wanted to be a nurse anesthetist. And that's pretty much how my path started into nursing.
Wow. Well, where were you born and raised at?
So I was born and raised in Panama City. So I'm from there, homegrown. I live in Tallahassee now. I went to nursing school in Gainesville, And then I finished up my master's degree in Tampa, and then we relocated back to Tallahassee. So I'm happy to, be able to help my hometown as much as I can.
Your parents are still there in Panama City, right?
My dad still lives in Callaway. My dad actually is the Christmas house. A lot of you may know or have been there throughout the last 25 years. My parents, decorated their house every single year. And even after my mom passed away, my dad continued that tradition until Hurricane Michael. And then everything kind of got destroyed. But a lot of people know my dad and know his house. So, yeah.
Talk a little bit about, I'm sorry, you said congenital something palsy,
Third nerve palsy.
third nerve palsy. And what exactly is that?
So that's the oculomotor nerve. So that is the nerve that controls your eyelid. It controls movement of the eye as well as the pupil. So that is pretty much every year I would have to have a surgery because I would outgrow the sling that they would put in to hold my eyelid up at the time until, technology advanced and they were able to put in an adjustable sling. And so now it's kind of a minor surgery. It's not as big of a deal as it was when I was a child to have it completely replaced about every year.
Wow. Yeah, it's gonna be pretty
It was
rough.
hard.
Yeah. Well, walk me through really this path that you're on now, where, man, you're helping people with PTSD and you know uh, depression, and I mean, to utilize ketamine. I mean, this is a fairly new thing where it's being recognized as a valid treatment. And why did it take so long? And really, how did you get into it?
So ketamine was actually used in the 1950s as a horse tranquilizer. You'll hear that said a lot. A lot of people have a lot of, misconceptions regarding ketamine, and we'll definitely get into that. But ketamine is actually a pretty safe drug. So in the 50s, it was used as a horse tranquilizer. And then when the Vietnam War came along, they were actually using it in the field to treat soldiers who were wounded. And what they found was these soldiers didn't feel pain, and they were able to treat them in the field appropriately with them being anesthetized. And after Vietnam War, in the 70s and 80s, they started using it to treat veterans for chronic pain. Well, and also quote unquote shell shock. At the time we didn't know that it was PTSD. So there wasn't a name for it, so they called it shell shock. So what they found was their pain was getting better, but also their shell shock or PTSD was also improving. So that led to studies of, okay, well, if this is helping their pain, well, what if we microdose ketamine? Would that also help depression, anxiety, and PTSD? And lo and behold, yes, it does. So how I got into this, so I started working at a pain clinic about 3 years ago. I left my job as a full-time hospital nurse anesthetist so that I could work more part-time, also 1099, meaning I own my own business. I make my own hours. So I decided to take a position at a pain clinic. Loved the pain patients, loved doing this sort of work. It also offered me better hours, a little more freedom. In the meantime, I decided I wanted to look into open up a ketamine clinic myself. There are a lot of red tape. It's very difficult to open up a ketamine clinic. So I quickly got discouraged. However, kept taking courses, kept reading as much as I could about ketamine and learning as much as I could. And my now partner, Zohar, opened the clinic here in Tallahassee. So he knew my partner at the pain clinic and called him to ask him if he was interested in doing ketamine. And my partner was like, no, I'm not, but I do have the perfect person and somebody who is. So I ended up starting here last February, and I absolutely do not want to do anything else. This is now my full-time job. I've transitioned completely. And also we opened the Panama City clinic as well. So that is kind of how I got started doing this. In the meantime, I'm also working on my psychiatric mental health nurse practitioner so that I can provide more care for my patients and be able to do more. So I have a huge passion for this. I love doing this. It works very well, and the patients do very well, as you obviously know. And also ketamine has saved my life. So that is something that I am very passionate about as well, because it saved my life with severe postpartum depression.
Can you walk us through what ketamine actually does? What is the mechanism and how is it used to treat PTSD and postpartum depression? And
Mhm. So ketamine for PTSD, anxiety, depression, postpartum depression, OCD, bipolar disorder, it can treat all of those things. And when we do infusions for depression, it is a 45-minute infusion. And then I keep you 15 to 20 minutes afterwards to make sure that you're doing okay. So these are sub-anesthetic doses, or quote unquote micro dosing is what you will hear through the IV. So what ketamine does is ketamine is an antagonist or a blocker of a receptor. If you think of receptors as gates, gates are everywhere in your body and they open and close to either turn off or turn on a function of your body, increase your heart rate, help you to breathe, tell you when you're hungry, when you're sad. All of those things require receptors. And that's actually pretty much how most drugs work. They target a specific receptor and either turn on the receptor or turn off the receptor, or open and close the gate. So if you think of the drug as a key that goes to the gate and either opens or closes it. So in ketamine specific, it will go to these receptors called NMDA receptors. Those are N-methyl diaspartame receptors. And what it does is it antagonizes or turns off those receptors. When it does that, it causes a surge of a chemical, a neurotransmitter called glutamate. What glutamate does is it actually stimulates new nerve function, and it actually stimulates those nerve pathways to work better and also communicate better between each other. We feel that with depression, those nerve pathways are broken down and they're not functioning like they should be. And so ketamine goes in and basically resets them and restarts them and helps them function properly.
when we're talking about this, I think it's important for, I mean, maybe those that aren't struggling with PTSD, but still want to understand it because maybe somebody they love is struggling with it. But, you know, I guess that, well, I guess from being traumatized, you have these certain pathways so that whenever you're triggered, it may not be like this dangerous event, or it's just something similar that triggers that pathway to open up, and you're flooded with basically you are reacting as if you are being traumatized again. Is that and so what ketamine does is it repairs those pathways or closes the pathway and allows your body to kind of rewire itself back to the way it should be. Is that
Correct.
okay?
Correct.
Have they been using ketamine for this purpose all
Yes.
along?
Yes. In the last probably 5 years, it's become more and more accepted, and definitely in the last 2 to 3 years, more and more ketamine clinics are opening. The data from Europe will be presented this year on ketamine, psilocybin, as well as MDMA. So psychedelics truly are the future of psychiatry. And I see it as well. I see these patients go from horrific PTSD, horrific treatment-resistant depression, who have tried everything, been on every med, tried TMS, ECT sometimes as well. And they come in and they get ketamine and they're back to themselves. That is one of the most rewarding things about doing this, is watching a patient go from significant depression to where they can't even leave or get out of bed every day to, hey, I went to the grocery store today, or I'm back at work. I mean, it's such an unbelievable thing to watch.
You've been doing this for several years now, and I'm your partner Zohar.
Mhm.
He mainly operates out of the Gainesville clinic, right?
Correct.
And you are operating mostly in Tallahassee, but you also have the Panama City clinic that's open. And I guess you're actually installing another nurse anesthetist there
Yes.
to manage that. So yeah, so I'm really excited to see how your business grows and how many people you're able to help. Because as word gets out and people see the research, or they're motivated to dig into the research and see how well it's utilized, I would imagine the people that you're able to help is going to increase astronomically. When you're treating PTSD, I'm curious, like how you yourself have become trauma informed. And I mean, you're so, well, you're awesome to work with,
Thank
and
you.
and you're obviously trauma informed, like just the way that you talk with your patients, and it's like it comes to you naturally, but I would imagine there's some experience behind it that allows you to function at such a high level and awareness. So can you talk a little bit about that?
So, you know, before I did ketamine myself, these would be very, very difficult subjects for me. And now I can sit here and discuss this openly. The biggest thing that I want patients to know and people to know is, number one, it's okay to ask for help. I don't want a patient to ever feel that they will get any judgment from me, because that's absolutely not the case. Number two, absolutely know what this is like. I know what depression is like. I know what postpartum depression is like. And I do have some childhood trauma from, obviously, you know, being different, being picked on, being bullied. Those scars last, unfortunately. And, you know, unresolved childhood trauma typically turns into high functioning anxiety and PTSD as an adult. So I definitely have researched a lot of that and read a lot of that, because I also want to help myself, not only my patients, but I want to be able to help myself. So it's interesting. Doing this in the beginning, I became very overwhelmed, because obviously I'm an empath. So hearing trauma over and over again, I became extremely overwhelmed, and almost to the point to where I didn't know if this is what I wanted to do anymore, because I couldn't take it, as far as sadness. And so I knew that I needed to work on myself in order to be able to help patients, because I was going to burn out. So I actually started doing CBT therapy, which is cognitive behavioral therapy, that focuses mainly on trauma and root cause of the problem, and how can we restructure your thinking to where you can cope appropriately with stressors and triggers in your life. Because anytime patients would talk about childhood trauma, or, you know, being bullied or picked on, that obviously would bring back memories for me as well. So those were unresolved issues that I needed to take care of. So fortunately, you know, ketamine was able to do that for me. I made more progress in therapy than I have my entire adult life. And I've been able to openly discuss these things now. And now I'm able to talk to patients and help patients because of my experience as a child. You know, high function anxiety unfortunately affects a huge number of professionals, as well as non-professionals. So high function anxiety can rear itself as the person looks like they're an overachiever. They are extremely intelligent. They work hard. They people please, so everyone likes them, but they will people please to their own detriment. And that was me. So those are things that are very difficult to deal with and very difficult for me to talk about until recently. And that is kind of how I view my patients. How would I want to be treated, and how would I want someone to react to me? And I would want them to react with compassion and empathy. And, you know, a lot of times, unfortunately, in our medical community, that is not what patients are given, and that's not how they are treated. So Zohar and I both feel very strongly that we do things differently. That is one of the reasons why we don't have a secretary, because most of the time when patients call, they're calling for help and they want one of us. So we answer our own phones. And so if patients call, they will always get one of us.
I never even considered that. I just thought I was special.
You are special.
Can you explain the process of, you know, when you're utilizing ketamine to treat PTSD using low doses, uh, what did you say?
Sub-anesthetic.
Sub-anesthetic.
Mhm.
And there's multiple sessions that you do, and you slowly increase the dose to a certain point. What is going on in the brain and in your body chemistry through this loading process? And how does the infusion, I'm just curious about the mechanics of it all.
So there's two sides to ketamine. There is the actual chemical side, and that is the side that I was telling you about in the beginning, where you get that surge of glutamate and the receptors, basically the ends of the receptors restructure themselves, and you are able to communicate better between each other. So that is the chemical side, what chemically ketamine does and kind of repairs. So also ketamine has psychological properties. So ketamine is the absolute safest psychedelic that we have to treat depression and anxiety. It is safe because number one, we can turn it off. IV is the safest route. There's other routes that you can get ketamine, but IV number one is the safest. It's the most studied, and it's the best chance for patients to feel better. So basically, psychologically, what happens is ketamine can bring out lots of emotions. It can also bring out suppressed memories. I kind of akin suppressed memories to parasites. That's kind of what they are. And they're memories that patients can't necessarily access, or because our body is very smart, our brain is very smart. So our brain's defense mechanism for some people is, when they have a trauma, is to bury it, and so that you don't remember it, or you black out, that kind of thing. So that is our brain's natural defense, because our brain's job is to keep us alive. Our brain's job is not to keep us happy, it's to keep us alive. So in order to do that, any traumatic event, that's why patients a lot of times don't remember traumatic events, because their brain, that fight or flight response, immediately suppresses those memories. So what ketamine does is it brings those memories out, and it brings those feelings out, so that you are in a safe place, and able to discuss those feelings and memories and work through them. So that is kind of how the healing process works, is you have to have both pieces, not only the chemical aspect of ketamine working so that you feel better, but also the psychological aspect of repairing what's broken.
Speaking from experience now, yeah, it's just my personal experience. There's been a couple of sessions where afterwards it was like this closet of just fucked up shit was opened, and it was stuff that, I mean, I wasn't even aware that I had forgotten or buried, and now it's there. And it seems like it would be harder than it is to deal with. I feel like that's like a second or a third function of the ketamine, is being able to address those issues in a way that, I mean, I just didn't have the ability to do before. And it's phenomenal. I mean, I just have, I mean, I've spent a couple of days, crying and that kind of thing. But I mean, for those that have listened to a lot of my episodes, it's possible that you heard one of the conversations about the healing properties of crying, like the chemicals that are released when you cry. I mean, I feel like if I had dealt with those traumas when they happened, maybe by crying, I wouldn't have buried them in the first place,
But that's not your fault. That's your body's natural defense, and your brain's natural defense is to survive.
I'm blown away by what you're doing, and just, I hate that I just learned about it. 'Cause, man, I would have jumped all over this years ago, but I'm here now. Maybe I wasn't ready for it back then.
Mhm.
For veterans that, they're being treated by the VA. I mean, this is a VA approved treatment. Does the VA pay for it?
So in some instances, yes, and that would be basically a veteran would have to call TRICARE and see if they would consider covering it. But I do have patients under TRICARE who have been able to get approved. That's kind of state specific sometimes. Florida, we are a little bit behind, as always. Oregon and all the states in the Midwest are always way ahead of us. So we are a little bit behind here in Florida, but insurance companies slowly are starting to, even consider reimbursing some. So we are getting there. We are trying. The reason why ketamine is not typically reimbursed or paid for or covered is because it is off-label use. So even though ketamine is an FDA-approved drug for the use of anesthesia, it is not an FDA-approved drug for anxiety, depression, PTSD. But drugs are used all the time for off-label use. That's not uncommon, but that just gives your insurance company the reason to deny it. So I promise we are working on that. Zohar and I both, kind of fight for insurance companies. There are hundreds of CRNA-owned clinics across the nation who we are all fighting for the same thing, to help patients and more patients as possible. So we do have a nonprofit. It is called Veterans Mind Health. And so any veteran who cannot afford care, we will take care of them for PTSD, anxiety, and depression. And for us, we donate our time so that the money goes further. We are taking donations, even if someone donates $50, that anything helps. And so all of that money 100% goes to taking care of veterans.
Is there a link on the website to be able to
There
do
will
that?
be, yes. The nonprofit took us almost 2 years now to finally get approved, and we submitted everything. So that has been something that has been huge for us, that we are at least now able to take donations. So that's the final piece, is having the website done as well as the link so patients or people can donate.
Is there like an application process that a veteran would
Yes.
need to?
Yes. They would have to show financial need, and they would also have to submit their DD-14 so that we know that they are a veteran.
Now, we've mentioned Zohar a couple of times. I plan on
Mhm.
having him on the show to interview him, but can you talk a little bit about him and the role that he plays in this, the nonprofit and the clinic itself?
So Zohar is the founder for Florida Mind Health. He is the mastermind behind all of this. He has been doing this for several years now, and he is also the one that trained me and made me the provider that I am, and basically helped me in order to be able to do ketamine. This is completely different than anesthesia, and it was something that I had to learn how to do. You can read in a book all you want, but the book doesn't really help you in real life experiences, how to help patients with ketamine. So I was very fortunate and trained well, and he trained me very well. And now, we have 3 clinics. But he is an excellent provider, a wonderful CRNA, and an even more amazing person.
When we were first establishing care and all that, uh, you outlined the loading process was going to be 6 to 8 infusions, and the doses go up. It increases to a point where you find the therapeutic dose.
Correct.
Can you talk a little bit about that process and how you determine what the dose is, and how you determine whether it's 6 to 8 treatments, or I'm curious about that.
So basically, the most researched amount of ketamine basically is 6. That is the kind of magic number that shows the best potential for lasting relief. The last thing that you want to do with ketamine is do 2 or 3 infusions and feel better, and then stop, and in a couple weeks you're going to feel bad again. So that is why we typically do a minimum of 6 infusions. Also, some patients, I can go up faster than others. It all depends on how the patient tolerates the ketamine. So ketamine does have some bad side effects, and we can talk about that in just a second. But 6 infusions is the best chance to get lasting relief. And by lasting, I mean 2 to 3 months before you have to come back for a booster infusion. What happens is when we get to treatment 6 is I typically will evaluate the patient, see how they're doing. We will do PHQ scores, which is for depression, and GAD-7 scores, which is for anxiety. So we do both of those scores and compare those scores to the beginning, and also how the patient verbally tells me that they're doing. And if they aren't quite where we need to be, then we will go ahead and do 8. Or if they are just starting to feel better, I don't want a patient who is just starting to feel better, feel bad again in a week. So we will go ahead and do 2 more. I will tell you, most patients who have severe long-term PTSD or treatment-resistant depression typically take 8. And then after that, we go to maintenance. Maintenance for the average patient is every about 2 to 3 months. They will come back and do 1 infusion. I do have some patients who may come monthly. It's usually my younger patients with higher metabolisms. And then I have patients who can go 4 or 5 months, but the average patient's about every 2 to 3 months.
And is that because the ketamine like is stored in your body, or?
Yeah, so basically what happens is those receptors get reset, and over time they kind of revert back to the way they were. For some patients, they actually can reset and stay that way, and then they never have to come back. But that's not typically what we see. Typically, patients have to come back for booster infusions because eventually the ketamine wears off.
Let's talk a little bit about the side effects and how you manage those.
So bad side effects of ketamine are increased blood pressure, increased heart rate. So patients are monitored continuously throughout the infusion. The blood pressure is monitored as well as pulse ox, EKG. So I know at all times what the heart rate is, what the blood pressure is, and as far as the other bad side effects psychologically, hallucinating and dissociating. So those are typically the 2 that patients don't like. So hallucinations, you can see people, you can see different things, you can see distorted things, colors. Also dissociating. So dissociating is the one that's typically the most difficult for people, especially people who are very type A, high functioning, kind of control freaks. Dissociating can be very difficult because you feel like you're not in your body, and that's such a strange feeling. So that is why we gradually have to go up on the dose, because what we do is we start off on a lower dose, and I want patients to gradually feel that feeling before they completely dissociate. The reason why we want to get to that part is because that's where patients can actually meditate and work through things that are going on with them. So as we progress in dose, that gets more and more intense, but they get easier to handle with each subsequent infusion. And also, you learn how to tolerate ketamine better, and you kind of know what that feeling is before we get there, and it's so strong, if that makes sense.
Yeah. Well,
You can also have some nausea. I do treat nausea. I have several different anti-nausea medications. Sometimes with patients, they can be dehydrated, so we've had to give fluids. Also, you can have a mild headache and basically feel a little drunk for about an hour afterwards. The headache typically doesn't last long. It's usually a very annoying headache, which Tylenol, ibuprofen, caffeine can take care of, and also make sure that you're staying hydrated. But we treat all of those symptoms as best we can, but they are very short-lived.
you recommend that when you were going through the ketamine therapy, you're also getting some form of psychotherapy.
Absolutely. Ketamine can bring out lots of emotions, like we just talked about, lots of past events that could have happened that you obviously don't remember. They were suppressed and now they are coming out. I am not a trained therapist, nor do I want to be. Although I will talk to patients, absolutely. I will always be here, if patients are suicidal, anything like that, I'm always here to talk to them. My phone is always on. However, it is important for patients to talk about those things and process them, because those are the patients who I typically see that struggle, are patients who do ketamine and they feel better, but they don't work on the underlying issues. And so it's almost like a negative vicious cycle of I feel better now, but I didn't work on anything. And 6 months later, I'm back in the same spot that I was because I didn't work on my coping. That is the common theme that I see with patients, is their lack of coping mechanisms.
Kelly, I gotta thank you so much for taking the time to talk with me and share what you've been doing and just really how many people out there could actually use this therapy to help themselves. So thank you so much.
You're welcome.
Thank you for listening to this episode of From Embers to Excellence. Please like and subscribe to my YouTube channel. Follow me on your favorite podcast platform and visit hollenbachleadership.com for additional content. My goal is and always will be to add value to as many people as possible. So if I can be of any assistance to you or someone you know, please connect with me via email or on one of my social media accounts, linked on the homepage of my website. Remember, our failures don't define us unless we let them, and the only true measure of a leader is the success of their team.